It strikes millions of women, interrupts their sleep, and keeps them from enjoying their favorite activities with family and friends. It's called urinary incontinence, the accidental release of urine. 30 million women are afflicted with incontinence, yet embarrassment keeps many from discussing it, even with their own doctors. But women with incontinence say it's time to bring this important issue to the forefront. Gail Stein is one of them.
My symptoms for incontinence started when I was very young. My nickname was Gigi Gigglepuss, and what my friends didn't know was every time I laughed, I would wet myself. I knew I had a problem, but I really didn't see anyone. I didn't know who to see. And then I had my first child. He was a breech delivery. And after that, I was in the bathroom all the time.
Gail sought the advice of women's health specialist and urogynecologist Dr. Maura Rabin. Dr. Rabin helped identify the type and cause of Gail's incontinence. There are two main kinds of incontinence. Stress incontinence, which is the leakage of urine when a woman coughs, sneezes, or jogs, or puts other pressure on her bladder. Or urge incontinence, when a woman has a sudden, urgent need to urinate and may not make it to the bathroom in time.
When we assess a new patient for incontinence, the first thing we do is listen to the patient. We take a very thorough history. And then we do a thorough physical examination, including a pelvic exam and a neurologic examination. And by the way, the sooner a patient comes to see us and the younger she is, the easier it is to treat.
Once the type of incontinence is identified, a customized treatment plan is executed. Treatments range from medication to physical therapy, including biofeedback and electrical stimulation, and surgery.
Some of the more popular non-surgical treatments include fluid management. In other words, take your body weight, cut it in half, and that's the amount of ounces you should have in one day. Stop smoking because you don't want to keep coughing and hurting your pelvic floor, avoiding constipation, trying to keep a normal body weight, avoiding obesity, and also avoiding your food triggers, some of which may be caffeine, alcohol, chocolate, hot peppery foods, and occasionally aspartame, the artificial sweetener aspartame. Medications can help incontinence by decreasing the bladder contractions. Many types of urge incontinence are because of too many bladder contractions, and the medications will calm the bladder down. There are many other non-surgical treatments available for women with stress, urge, or mixed incontinence. One of the most common and popular types is called pelvic floor muscle exercise, used to be known as Kegel exercises. That's when you hold your pelvic floor, you tighten the vagina to a count of 5. I like to relax to a count of 5, and you repeat that 5 times. That's called a set. Try to do 10 sets a day, and then you can build up gradually to 20 sets a day.
A fairly new procedure, which is an excellent choice for patients with overactive bladders, is the Medtronic's InterStim procedure. A little tiny wire can be put into place in a very non-invasive fashion. It's a half-an-hour procedure, and this gets put in a very discreet area, and it's connected to a source completely concealed, and this will override the overactive bladder. It will retrain the bladder, it will interrupt the abnormally active signals, and it will make your bladder calm down.
The standard surgical procedure for the treatment of stress urinary incontinence is a suburethral sling. During that procedure, we place a small piece of mesh underneath the urethra, the tube where the urine comes out, in order to support the urethra. This procedure has approximately an 80 to 85% success rate for being completely dry.
It may take a combination of therapies to achieve results, but incontinence can be improved in most cases, sometimes dramatically, and even cured. Gail Stein is living proof.
I used biofeedback machines. I learned how to do Kegel exercises. I kept a diary. I monitored everything that I did. And I was very surprised that it took only a very short time before I could train my bladder to behave. You can be treated, and it doesn't have to be invasive. You can do it by yourself, and it doesn't really take that long. You just have to work at it and know what to do.
Dr. Jill Rabin is fighting for women with incontinence. This obstetrician gynecologist and urogynecologist is working to remove the stigma of incontinence and help women get the treatment they need and deserve. Written along with her friend, patient, and published author Gail Stein, Dr. Rabin's book, Mind Over Bladder, I've Never Met a Bathroom I Didn't Like, combines personal stories of living with incontinence with critical medical information.
Well, I'm very passionate about helping women with incontinence because it is simply not dignified to leak. I want to give women control back over their lives so they can enjoy their lives. I also think that in most cases incontinence is treatable and sometimes even curable, and besides, it's the right thing to do.
Dr. Rabin practices at LIJ Medical Center, part of the North Shore LIJ health system, which is on the cutting edge of women's health. She works alongside a team of esteemed physicians dedicated to providing their patients with state-of-the-art treatments for incontinence.
The North Shore Long Island Jewish Health System could not possibly be more committed to women's health care. They have recently constructed a 9-story dedicated women's hospital with no other function than to make it the single best, most advanced, highest quality women's care facility in the nation.
I was having many years of problems with incontinence, having to go to the bathroom too frequently. I ended up receiving the Medtronic's InterStim, and it worked. It worked. It was very easy, outpatient procedure.
Was always very conscious of knowing where my pit stops were to go to the bathroom. When I was driving, I had to know where like gas stations were so I could make it to the bathroom quickly, because the sense of urgency was intense. The doctor recommended that I see a physical therapist, and they work internally with you to help develop the walls around your bladder. I'm very well. I'm actually able to drink water during the day. I still don't have the confidence to drink a lot of it because there's still some residue of that, feeling. But I drink during the day. I'll have tea, I have coffee in the morning. I drink water, and I have a sense that I'll be able to control it till I get to the bathroom.
Millions of women will suffer from incontinence, but they don't need to suffer in silence. Visit us online at northshorelij.com.